this country and our people, we're in the middle of another civil rights fight. Amen. And that civil rights fight is for affordable, accessible, guaranteed quality health care for everybody in this country. And we also know that health care is economic security and opportunity for each and one of us. You know, last month we witnessed a lot of huffing and puffing by people during the month of August who were opposed to health care reform. Unfortunately, a lot of their reasons were misguided. But we must also remember that we're all in this together. And I am my brother's keeper. We also know that health care reform is going to bring stability, security, and peace of mind to every single American in this country. We also know that health care reform is a moral imperative. You know, 14,000 of our brothers and sisters lose their health insurance every single day. And there's over 50 million of us who are uninsured. Every 1% that unemployment goes up adds another million people to the rolls of the uninsured. We also know that health care is a medical imperative. We know that the lack of preventive care and primary care is causing undue hardship to tens of millions of Americans. We also know that many illnesses that could be treated and that could be treated easily simply are not treated because people do not have access to insurance, and those situations get much worse. We also know that health care is an economic imperative, that the cost of inaction is not an option. American families, the #1 issue of home foreclosures, the #1 issue of people going bankrupt is because of health insurance. We also know that American businesses cannot compete internationally because of the cost of health insurance. We are not going to allow the special interests who embrace the status quo to stop Congress and President Obama in passing health care reform. Let me ask you this, are we going to push for change? Are we going to push for change? Are we going to push for change? Amen. We know that healthcare reform is going to control costs, provide access to everyone, and we also know that healthcare reform is going to give us a choice to either keep the health insurance we have or to be able to choose the public option. I want each of you to join us in the coming weeks, in the coming months, and your place of worship. We're having, at the beginning of August, October, Health Sabbath weekend, that we've got organizing kits that people can go back into their place of worship and talk about healthcare reform and get people involved, to get people to talk to their pastor, to get to talk to their, each individual in the pew, because we cannot afford not to pass healthcare reform. Are we going to push for change? Thank you very, very much. Thank you.